This is Native America Calling. I'm Tara Gatewood. Eating the right food and getting exercise are certainly important to keeping your body healthy. But health professionals also encourage looking at the big picture for overall health. That's where the term wellness comes in. In more than being free from illness, it is more. It's the active process of making healthy choices. And wellness is not a new concept for Native America. Keeping life in balance, encouraging physical, mental, and spiritual awareness is a part of daily traditional life. But human resource professionals, individuals, and tribal experts are coming up with new ways to approach wellness to help cope with daily pressures as well as larger issues like intergenerational trauma. Today we ask, how do you define wellness? Is it a concept you think about? And do you have your own methods to work towards a healthy living? Call us and share your experience. The number is 1-800-996-2848. And you can also send your tweets to us at 1-800-99-NATIVE. And to start us off today, we're going to go to Zuni Pueblo in New Mexico to say hello to Leatrice Lewis. And she's an independent contractor and holds a master's in public health. And she is a health educator. She is Zuni Pueblo. And most people know her by Lee. It's our pleasure to welcome her to the hour. Lee, welcome to Native America Calling. And Lee, thanks for greeting us in your language. And I think that's even part of when we start thinking about wellness and what it means, even down to the language. But Lee, let's go ahead and hear a little bit more about how you define wellness.
Well, when we got started here in Zuni, that was about 32 years ago. And at the present moment, many of the other teachings that come through are those indigenous concepts that we use on a daily basis. And these have been it's not an academic worldview, but these are healing-centered practices, concepts that we all still engage in, and it's very enduring as a concept. And so I will be further describing and discussing some of these views that we have as we go through this hour. These connecting patterns of thinking have allowed us to thrive in our communities. So that's what I will be talking about. But I am looking forward to meeting Dr. Warren and Beverly Warren in person at the Body and Earth Conference. And this will definitely talk about the future of Native wellness in Minneapolis next week, September 12th through the 15th. And I'm really grateful that I've been invited by Freedom Lodge with Dr. Ruby Gibson taking the lead in the organization of this conference.
Sure. I was just taking a look at some of the different sessions and some of the presenters, and I can only imagine how this conversation of wellness will evolve, and even some of the things that Dr. Gibson is saying. And I'm just going to read one of her quotes. She writes, "To understand what modern-day wellness implies, we gather our knowledge, assets, and assess our risks and envision what it will take to create healthy indigenous communities. And a big key question, what we do to the earth, we do to ourselves." Those are Dr. Gibson's words. And just even thinking about that, our connections and what wellness means, the more we get further into this conversation, we're ready for you to also join us. What do you think when we say those words, wellness? When you hear those concepts, how do you say it in your language? 1-800-996-2848 is the number. And Lee, I always think it's interesting when we get these kind of conversations going, or we're talking about being well, and then we think of our language. A lot of times, words about being in a good way, or just even the word life itself, is what we say when we're talking about all these things. Tell me a little bit more about traditional Zuni values and coming into this and understanding. Go ahead.
Definitely. It's in our daily life, in our prayers that most people should say in the mornings. And also here in Zuni, there are people praying for all of us that live here in Zuni, across Indian country, and for the whole universe. And in our prayers and dances and our gift giving and offerings to one another, we're always giving gifts of enlightenment. You know, our knowledge of giving of life, light, and this requires you to really look at the knowledge base that you have in your own culture, the commitment to living this way of life, and your own goals and ideas that you live by. The strength that's offered through the prayer is to really note this responsibility to self and others and the universe. It gives one an integrity of life as a human being, and we use this information, this strength, to really look at how we can motivate ourselves, reflect on many of this indigenous knowledge, on how to problem solve and make decisions for our own wellness. And it provides growth in many, many areas, in our courage to really use the indigenous way of life, to be creative, to take risks. And like you mentioned, it provides this big picture of universal principles that we all live by as human beings, this interdependence or interrelatedness, which creates the vision for our wellness and the values that we live by, you know, that grounds us in so many different ways that we will live accordingly. These are core values that have been listed by our ancestors, that we will respect one another. And if you even venture off on another direction, that's really not being well. And when we think before we act and consider the consequences, that's a big one. Because many of our challenges, you know, in our communities is, like you mentioned earlier too, about how well is our earth is determined by how we treat our own bodies. And so one of the challenges that we're always considering is the food that we eat and the plants that we grow. Are we doing that? Are we living according to what that means for the earth and to us? A lot of times we have to, in our work in wellness, we have to be very careful and sensitive about the word nutrition, because many of our people don't have access to good food, even though we may go to a nearby town and buy the fruits and vegetables. You know, we have to really consider, where did this food come from? And sometimes you also have to be sensitive to the people that get food stamps and are also on a limited budget. And so we have to consider, you know, what we provide as information.
Certainly. And Lee, I got somebody who I think wants to say something more about that. We're going to go to our caller again. If you want to join us, 1-800-996-2848. Let's go ahead and say hi to Melvin, who's in Santee, Nebraska, listening in on KZYK. Melvin, thanks for giving us a ring. And go ahead, add your thoughts.
Well, good morning. I would like to just express my support for the ones that are out there working in this health, getting well, getting healthy. And myself, I'm kind of a poster child for, I'm a dialysis patient, I'm an amputee, you know, and all that is from eating commodities, sugars, salts, abusing these different foods. And, you know, getting healthy is so important for me now to see these younger ones not to continue, get them off the salt and sugars, get them off the white breads, unhealthy foods. You know, I see more kids at the store buying Cheetos and Mountain Dew than anything healthy.
Sure,
It's really,
and a lot of times when they're buying those things, they're not even considering just how much salt is in it, or amounts of caffeine, and then you think of sugars. You know what? Great things to add to this. And Melvin, great to hear from you there in Santee. And Lee, hearing Melvin, what are you thinking?
Well, throughout my lifetime, since 1986, when we established our wellness program here in Zuni, I was very fortunate to have traveled throughout Indian country, from British Columbia all the way down to Mexico, to Baltimore, Maryland, to Washington, D.C., and I can't help but think of all the people that have led and supported the way to wellness. And these people, if I may mention a few, Dr. Everett Rose, Josephine Wakanda, and the many doctors that have come to Zuni, certainly have given us this academic worldview of, nutrition and a healthy lifestyle through fitness, and that all works. Eating less sugar, eating less salt to take care of ourselves. But now we have to really consider coming back to our community thinkings of the connecting patterns that really have worked for us. And that's where I would hopefully think that the future of wellness will lead to, because we've tried all these things.
Sure, and we've seen a lot of complications and not connected to who we are. We'll be right back. Thanks for tuning in today. I'm Tara Gatewood from Isleta Pueblo, and we are talking about wellness and how do you define wellness in your life? What about wellness for your family, your community? Call us and share your thoughts. The number is 1-800-996-2848. And with us today, joining us from Zuni Pueblo, is Leatrice Lewis. She's an independent contractor and holds a master's degree in public health. She's a health educator, and she's also a proud member of Zuni Pueblo. Also here with us, joining us today from Bismarck, North Dakota, is Dr. Donald Warren, and he is the Associate Dean of Diversity, Equity, and Inclusion, and he's also the director of the Indians into Medicine program, all this at the University of North Dakota School of Medicine and Health Sciences. Dr. Warren is Oglala Lakota. It is our pleasure to welcome him into the hour. Dr. Warren, welcome to the program.
Thank you so much. It's a pleasure to be here.
And Dr. Warren, we heard from Lee and just breaking open those concepts of wellness, where they come from, how deeply rooted they are into our cultures, our traditions. And hearing some of that, Dr. Warren, how do you like to define wellness?
Well, from a traditional perspective, and I was very fortunate to grow up with a family that's very culturally connected, and we know the ways of our people in Oglala perspectives, but it's very similar in other tribes too. But wellness is more than just physical health, and wellness includes balance spiritually, mentally, physically, and emotionally, and recognizing that in order to be healthy, we have to be in balance in all four directions. And we certainly see cases where people are physically healthy, their laboratory data is good and their blood pressure is good, but they're not well because there might be emotional or spiritual imbalances. So we look at it as much more of a balance among those four forces, not just in the physical arena. And that's one thing we try to address in our training of the next generation of medical students, is to think beyond just physical health. Of course, another word for doctor is physician, and that has the same root as physical. That's actually from the Latin physic, meaning natural sciences. But as indigenous peoples, we think of wellness as much more than just physical health. Of course, physical health is a part of it, but it's one part of a bigger picture.
And Dr. Warren, I had the privilege of listening to you speak at the Association of Healthcare Journalists conference this spring, and you were talking about how sometimes we don't achieve wellness because things are put in silos, especially in our communities, especially in the healthcare that we receive. And a lot of times we are thinking of things disjointed. And how far away from good wellness are we when we're living in these kind of silos where mental health is never talks to, other parts of our health system? And talk to me more about that.
Yeah, our systems are set up as silos, typically speaking. Some communities are doing a better job of integrating services, but generally speaking, we look at public health and prevention in its silo, medical treatment in its silo, and then mental health and behavioral health in a separate silo. And in truth, social services have a huge impact on wellness, and those are, again, siloed separately as well. So when we think about the need to promote wellness in communities, we really should be looking at this in a much more holistic and comprehensive way. And traditionally, at least in the way I was taught, we wouldn't be approaching just the components of a person. We'd be looking at things much more holistically and recognizing that the health of the community has an impact on the health of the families, and the health of the families has an impact on the health of the individuals. And in modern medicine, we tend to look at one-on-one patient care within a silo without recognizing that there are all kinds of social and cultural and economic influences that have a huge impact on health and wellness. So I think we've made a lot of mistakes along the way in terms of how we've developed our health system. And it really isn't a system. It's multiple systems that are quite often competing with each other for resources, competing with each other for focus and attention. But in truth, we should look at health and human services as one arena in which we're trying to promote wellness in a much more holistic manner. So I think we have a long way to go to make those steps in our current system. And in truth, we have a lot to learn from indigenous approaches, which were much more naturally focused on overall wellness rather than just individual services and programs.
And so when we think of our tribal communities, how do we start implementing some of this? Are we talking about, having different departments sit down together and think collectively? And then, sometimes the community is never involved in this planning. Talk to me more about that.
Well, each community is different, so it's hard to make blanket statements because there's so much diversity, as you know, across Indian country. But there's some models where it's being done well. If you look at Alaska, what they call the NUCA model, they're integrating medical and behavioral health care and linking it to social services, I think, in a pretty effective way. One of our challenges, certainly here in the Northern Plains region, is that we have not only silos of services, different levels of government or operating programs. So quite often we will have Indian Health Service operating clinical services at the federal level, but then the substance abuse treatment programs and public health programs are operated by the tribes. And quite often they're at odds with each other. And it really is unfortunate. We can look at the health and wellness of the relationships among our agencies as having a direct impact on the health and wellness of individuals in the community. So each population is different, but yes, certainly meeting and agreeing that the primary focus should be on wellness in the community, not just who's in control or who's in charge of which programs. Unfortunately, we're not there yet, and some communities are doing it effectively. Some communities have a long way to go in terms of even sitting at the same table and working collaboratively. So in addition to all of the social and economic challenges that many of our communities face, the dysfunction among systems is also having a negative impact, unfortunately, on the health and wellness of our people.
All right, thank you for that. And then you throw politics into it all. Folks, what are you thinking about everything that you're hearing today? Give us a call. 1-800-996-2848 is the number. And Lee, the road that took us to you were doing something in your community to create better outcomes when it comes to wellness. Can you talk to us a little bit about how you have implemented things to create a better wellness, maybe even for individuals as well as the community?
Well, currently we have this group that we entitled our series. It's called Live Well, Feel Better, and Start Living. And this is a group of individuals who noticed that there were groups of people in silos that needed to really come together. And so one individual at our hospital here said, let's do, something different. And so Gail, she works at the Indian Health Hospital here in Zuni. She got us together, and we started brainstorming all the alternative healing modalities that are currently being practiced in our community. And so we held our first series at the Zuni Wellness Center on a Sunday afternoon, and it was amazing. We had a whole bunch of people, and when we were brainstorming, it was amazing. We came up with 20 different types of healing modalities that we could offer to our community for free, of course. And so we have Dr. Sutanto, who's a chiropractic practitioner who lives here in Zuni. He volunteered his services to talk about the assessments that he usually does for a person needing help with the body. And Gail provided the healing touch. And since I've been taking a course with Dr. Ruby Gibson since January, she's taught us a few techniques on how to utilize the power of self-healing with people. And one of the techniques that I was doing was brain spotting with many groups of individuals here in Zuni, and also somatic archaeology, which is also one of Ruby's, Dr. Ruby Gibson's technique. She's also taught us how to heal ourselves through many, many other techniques, but some of the other people at the series also were doing yoga and Tai Chi, and it was an amazing gathering. This Friday, we're actually meeting again and planning on another event at the Wellness Center. And so this is just one example of groups of people coming together to implement alternative healing modalities that are currently present, and people have utilized these services in our community. But this is the first time we're all coming together to provide these services to our community. And I think it's got a great response. The first time we did it, there were a lot of people interested in learning more about how they can self-heal themselves. And these are...
And hearing some of this, Lee, a lot of times folks just see the end results where class pops up or a session where people are invited to come in and hear information. And now that you're getting that background view of why these things are there or what your community members have gone through to provide these kind of opportunities, what do you think? Did you miss this part of the story? And now hearing it, are you seeing it as something that maybe you'd want to get involved in? You can give us a ring. 1-800-996-2848 is the number. And some of the things that Lee mentioned years ago, you would never see some of these connections being made, or even taking a look at how spiritual health is woven into all of this. And Dr. Warren, somebody who has gone through medical school, has seen the rigid side or the silo side of things. Now you're seeing people, acknowledging the value of all these things. Are we in a good day when it comes to thinking about how we do achieve wellness and especially through funding or the way things are organized in our community? Dr. Warren?
Yeah, absolutely. And recognizing, again, that there's more to wellness than just physical health, but even thinking about systems and policy, again, the health of our systems has a direct impact on the quality of services and subsequent outcomes for wellness in our population. So we can't, again, just think of wellness just only as the responsibility of each individual. Of course, we each have a role in our own wellness, but as leaders and as policymakers, we have a role in creating the circumstances in which people can live in a healthy way. So we have a lot of work to do. And of course, when I'm working with medical students, we do focus a lot on trying to promote healthy lifestyles in the individuals. But if we don't have access to healthy food, if we don't have sidewalks, if we don't have safe places for physical activity, if we don't have good transportation, we're not going to be able to prescribe our way out of those deficits. So it's beyond the medical model. So clearly medicine and primary health care have a big role in promoting wellness, but it's much bigger than that. We have to look at our entire systems and what are the supports that we have in place in our communities that can promote healthy lifestyles and promote wellness.
All right, thank you for that. And we are looking forward to also adding you to the conversation. What kind of things do you do to achieve wellness? Do you make sure you go for a walk every day? Or maybe you spend time helping your family, or maybe even just some quiet time alone? All of that is woven into a balanced life. Wellness, what do you think? Give us a ring. 1-800-996-2848 is the number. Or maybe you want to tap into this part of the conversation talking about our community being well. What does it take to achieve some of that? 1-800-996-2848 is the number. Everybody is welcome in this discussion. And I want to go ahead and bring in one more voice. We're going to say hello to Beverly Stabber-Warren. She is a coordinator, advisor, and nurse mentor at the Native American Nursing Education Center at South Dakota State University College of Nursing. And she is also Oglala Lakota. It is our pleasure to have her here. And I understand many people know you as Bev. Bev, it is my pleasure to bring you into the hour. Welcome.
Thank you.
And Bev, as you are hearing some of this, and feel free to talk about your relation to Dr. Warren, but your thoughts on thinking about wellness in the way we are today.
Well, wellness, of course, is something that affects all of us. And having lived in the urban communities most of my life, although I was born and raised on the Pine Ridge Reservation, and my first language is Lakota, and I never met anyone outside my extended family until I was sent to the boarding school at age 6. And so my foundation has been Lakota in terms of the language and living in an extended family setting and learning from the adults in our family. It wasn't just our parents. It was aunties and uncles and grandparents. So I now, as a Lakota elder, I look back on why I was able to continue with trying to live a balanced life. It's because of what I learned during the foundational years of my life in the first 6 or 7 years. And, of course, back in those days, I was born in 1939, so you get a feel for how far back I'm going here. We lived way out in the rural area, and we rarely saw others except our own extended family, which was fairly large. And my grandmother had a garden, of course, and she always said to the grandchildren, and each one of us had an assignment. Like, for instance, I would be told to pick 5 carrots. And when I even think about that part of it, she was actually teaching us how to count, how to be precise, and not necessarily saying it as a lecture, but giving us chores, so that we were living what we were being taught. And another thing that formed my character early on was the fact that my maternal grandfather sang at dawn and at dusk.
And you know what? Bev, you are definitely taking us to a time where all these things were connected. It's almost the opposite of what we're talking about, of living in silos or seeing these things as separate. And all the things that you just explained were a time when things were connected. And I can only imagine how many people are turning to their elders to hear of these times to figure out, okay, maybe we need to look at some of that knowledge and why people were doing things the way they were to heal who we are today, to bring about better wellness. What do you think? 1-800-99-NATIVE. I'm Tara Gatewood. You've been listening to Native America Calling, and part of wellness is being able to evaluate your own life and being willing to make some bold changes if necessary. And have you ever had a moment where you said, I need to change? Give us a call, 1-800-996-2848. You just heard also from Beverly Stabber-Warren, a coordinator and advisor and nurse mentor at the Native American Nursing Education Center at South Dakota State University College of Nursing, coming to us from the Oglala Lakota Nation. And hearing to the time she took us to, what were you thinking? Do you think our elders had it right in achieving great wellness? 1-800-996-2848 is the number. Before we get any further into this, we're going to take a phone call. Again, if you want to join us, 1-800-996-2848. Let's go ahead and hear from a caller in Rapid City, South Dakota. I believe it is Laura. Laura, thank you for giving us a ring.
Hi.
Hi.
Hi. I have a question for Leatrice.
Okay, go ahead.
She had mentioned that she was taking a class, and it had everything to do with wellness and different techniques of healing. Where can I get more information about that?
All right, we're going to help you with that. Let's say hello again to Leatrice Lewis, an independent contractor who holds a master's in public health. She's a health educator coming to us from Zuni Pueblo, where she is a member. Lee, go ahead and help our caller, Laura.
Well, Laura, your help is right next door with Dr. Ruby Gibson. This journey that we've been on, 35 of us women and one brave Navajo man started meeting at Ghost Ranch, but it was Dr. Ruby Gibson, and we were taking a course called Historical Trauma Masterclass. And it's an amazing process because here we're talking about wellness, and there are all those underlying issues we have to address before we can work with the symptoms. And it's been an amazing process where we had to learn our trauma timelines for our community. And I'm from Zuni, and I did one for our community. Not only the timelines that are involved in many of the traumatic histories and events that we have here, but also our own timeline of personal trauma that has affected our lives, and how we can work on those underlying issues to heal ourselves. And we had to work really hard because in order to heal other people, we have to work on our own personal issues. And this is what this class has been. And it's been an amazing process. We're finishing next month, and we've had to really do a lot of work in this area. So Dr. Ruby Gibson, if you Google Freedom Lodge, www.freedomlodge.org, you will get to that course that will be offered again. And Dr. Ruby Gibson will be happy to talk with you on all the different requirements.
Okay.
And it's been a wonderful class.
All right. Thank you, Laura, for your call. You can ask questions too. 1-800-996-2848 is the number. And if you missed any moment or want to hit rewind on what you heard, we will be posting this program on our website, nativeamericacalling.com. There are also podcasts available on iTunes, Stitcher, and SoundCloud. Thank you for your call. And Beverly, you painted a great picture of wellness and things being in a good balance and understanding things as how they connect to each other. You are also an instructor now, and how much of what you just described are you weaving into what you're teaching the next generation of nurses?
Well, currently I did teach nursing in Arizona for 17 years, but my job here is as a recruiter and retention kind of work with Native American student nurses. And so my teaching is not necessarily in the classroom, although I do guest lecture in the program and other programs. So I always bring in the idea of learning from our history and learning from what we were prior to all the events that has taken place in our cultures. And we're still hanging on tight to those values and those ways of life that served us so well for so many centuries. So it is our responsibility as Lakota people and Lakota elders to teach anyone who wants to learn about it and at least introduce the ideas that could improve lives in many ways by learning what we did have in the past and that we still do. They're still there. We just don't teach it as we used to because our societies have changed.
And with that, this word wellness, has it always been used, especially thinking about your upbringing being a Lakota, or was it called something else? Go ahead, Bev.
And what do we call wellness now?
Sure, compared to what we used to. Did we always say wellness, or did we say it? Did we say it better, or did we just say it in Lakota and it meant the same thing?
No, it's basically the same idea of keeping well and not just physically. And the former interviewee, my son Don, did identify the idea of a holistic way of looking at our health. And this is the way I teach individual students that I mentor here in this program. And I talk about, of course, the medicine wheel philosophy of balance in your physical, mental, emotional, and spiritual self. And that our work as nurses has to have that component of holistic approach rather than just thinking of a patient with diabetes. There's a whole wealth of other issues to consider when you enter a patient's room who has a new diagnosis of diabetes, for instance, that they are not just a physical being there, that they are worried or feeling saddened or angry or questioning why the Creator's having all these horrible things happen to us as a people. All of that, those possibilities need to be known by our student nurses and our nurses as they enter a patient's room. That's a huge responsibility for a nurse to know that they have that power to teach and to settle and to talk to a patient and listen to the patient and attend to what their issues are and give your best effort to help that patient at the time that you have with them. Take advantage for every minute that you have as a caregiver.
And I know about you nurses. I was raised by a nurse, and the things that, that they are doing. And sometimes the nurses are the only voice that this patient might have of talking about wellness, or even a safe voice. And so that conversation becomes really important. And I'm glad you opened that up for us, Bev. You mentioned Dr. Warren, your son. We got him here, too. He's in Bismarck, North Dakota today, Dr. Donald Warren, and he is connected to the University of North Dakota School of Medicine and Health Sciences. He, too, is also Oglala Lakota, and I want to bring him back in. And Dr. Warren, we're getting ready to wrap things up. We still got time, but how do we use everything that we put on the table today to combat these high rates of diabetes, high rates of heart disease, and many other disparities? Go ahead.
Yeah, I think one of the upstream things that we need to think about is unresolved trauma. And we have issues related to historical trauma, adverse childhood experiences, the legacy of boarding schools, and then even the toxic stress that many of our people live within, whether it's on reservation or even in cities where we still have to contend with racism or discrimination or marginalization and poverty and all these other stressors. If you look further upstream, we know that toxic stress and unresolved trauma puts people at higher risk for things like depression, anxiety, and addiction. But also, we see a direct correlation between childhood adversity and higher rates of diabetes, higher rates of heart disease, higher rates of cancer. So I think that as a system, and from a more holistic and indigenous perspective, what we need is community-wide healing in the form of resolving trauma and acknowledging that it's there, but then using our traditional ways as a basis to wipe the tears, to acknowledge that the trauma is there, but to do something about it. And in truth, if we can prevent trauma in the next generation of children, that is diabetes prevention, that is cancer prevention, that is heart disease prevention. So I think we need to take a completely new approach and recognize that unresolved trauma is at the root of many of our health disparities. And as a system, we need to be smarter. We need to address this in a more holistic and comprehensive way. And we can do it as tribal health leaders. If we choose to go in this direction, that's the direction we will go.
All right, thank you for that. Got one call we're going to squeeze in before the hour's over. We're going to say hi to Macaw, who is joining us in Saskatchewan, Canada, tuned in today. Thank you for giving us a ring. You're on air. Hello, Macaw, are you there? Come back to the phone. Okay, send us an email, comments at nativeamericacalling.com. Dr. Warren, you mentioned young people. Is there anything more we can open up on the things that young people are facing that nobody on this phone call today ever faced that we need to consider?
Well, unfortunately, we still do have a lot of challenges with making sure that our kids live in healthy environments, and we still have a lot of adversity. We have a lot of abuse and neglect within many of our communities. And I think that we unfortunately haven't addressed it as adequately as we need to, because that generation then grows up and has the health challenges, but also what have they learned about parenting skills and traditional approaches to bringing up a family? You know, in the old way, what we were taught is that it was the responsibility of an entire generation to raise the next generation. So as a Lakota man, I am just as responsible for my nephew as I am for my son. And what a beautiful way to have a family. And again, with colonization and changes in our perspectives and our lifestyle, you know, the whole idea of a nuclear family is not indigenous, you know, just mom, dad, and kids. And it's an entire generation of siblings and cousins raising that entire next generation of children, nieces, and nephews. And I think it's a much more healthy approach to look at it that way and taking responsibility for that next generation of kids. And they, you know, again, the kids have other challenges that we didn't have in terms of social media and other types of bullying and how they're treating each other. So we also can't just assume that as adults we can solve it for them. We need to engage the younger generation in identifying the solutions.
Sure, opening our ears does a lot of good, especially when we are turning them to our young folks. And Dr. Warren, as we get ready to wrap things up here, got about a minute, any advice to people who are trying to create wellness in their community?
Well, again, it's every individual is different and each community is different. We have a lot of diversity across Indian country, but I think when we are looking at wellness, it's not just about ourselves. You know, it's wellness. What are we doing to promote the wellness of our family? What are we doing to promote the wellness of our communities? And again, in the old way of our teachings is that we're not just focused on individual needs. Of course, we have to be cognizant of that, but if we're going to promote wellness in our communities, we have to have a much broader focus. And I would look at, you know, what am I doing to stay healthy, but also what am I doing to promote the health in my family, the wellness of my family, and the wellness of my community?
And I think you are also, in the work that you're doing, also building our people who are helping our community, who are going into medicine. Maybe there's somebody who's listening today who also wants to follow up. Any context you'd like to give out in terms of coming into the field of health, or even just making their community stronger? Dr. Warren, any context?
Sure. Just in terms of looking at healthcare fields, we have such a terrible shortage of healthcare providers and health researchers and nurses, physical therapists. So they can always contact me directly through University of North Dakota, the website for InMed, Indians into Medicine. I'm happy to talk to people individually about opportunities. One of the challenges that we face also is just the lack of role models that are working in this space. Nationally, there are over 37,000 professors of medicine. So you can be either a assistant professor, associate professor, or full professor. So nationally, of full professors in medical schools, there's over 37,000 professors. Only 10 are American Indian. 10 out of over 37,000 that are full professors of medicine. So when I was hired at UND, I became number 11. So I increased by 10%. But it's just pathetically low numbers, and I want to see that change. I don't want the circumstance where the next generation feels like they're the only one at the table. We need to promote wellness across the board, and that includes education and health and economic development and workforce development, and these opportunities that we haven't always had in our communities. But we can't look at wellness just through the lens of physical health. There's a bigger picture.
Great. And I think a great statement to end our conversation today. If there's more you'd like to say, reach out to us. You can email us at comments@nativeamericacalling.com. You can also post directly on our website. And I'd like to thank all of the folks who joined us today, Dr. Donald Warren, Beverly Warren, and also Leatrice Lee Lewis. We are back again tomorrow with a look at films of the Native Cinema Showcase that went down this summer. Maybe you saw some of it. Go ahead and give a review of what you saw. Post it on Facebook or send us a tweet. We'll be looking at that tomorrow. Join us for that. Our executive producer is Art Hughes. Senior producer is Monica Brain. Associate producer is Andy Murphy. Sol Traverso is our intern. And Marino Spencer is our engineer. Antonia Gonzalez is the anchor and producer of National Native News. I'm your host and producer, Tara Gatewood. Thank you for tuning in. Join us here tomorrow.